right. Welcome back to another episode of the Digital Health Podcast. If this is your first episode, we have an amazing show for you guys. I'm gonna be honest. My name is Anthony Virgo. I am one of the co-founders and one of the hosts of the Digital Health Podcast, along with my co-host Kazar. For folks who don't know me, I spent the last 7 years at a health tech startup, and then we ended up shifting into this world of AI, and I kind of just jumped on it right within the healthcare world of things. And I've been able to build AI agents for clinics, providers, coaches, therapists in so many ways. And here's the Digital Health Podcast where we actually talk about a lot of those technologies, a lot of what's going on in healthcare, and then we bring on thought leaders to have this conversation. Kazar, go ahead and introduce yourself so we could get started with our guest and this podcast so the listeners could be hyped and excited about it.
Hello, everyone. My name is Khizar Shahid, and I have been working in the healthcare domain for quite a while. I started with the dental practices, then we collaborated together, and now we are working with a lot of healthcare professionals. We are working with cardiologists, psychiatrists, psychotherapists, psychologists, and now we are working. We are also running our own AI and marketing agency along with this digital health podcast. So this is the brief introduction about us. Now I want to kick it over to our guest, Dr. Kar.
Hey, I'm Dr. Antani, Kartik Antani. I'm a dentist here in New Mexico. And I've had a career of about 12 years now, starting as an associate to owning multiple practices. And now I'm still practicing dentistry, but I'm also helping in the tech center around dentistry, as well as AI and all the fun stuff that's going on around that now.
Definitely. First off, thank you for, just being open on being on the podcast. And I already know this is going to be an amazing episode. Usually when we first start off, we usually ask our guests, how did they get started in the industry? A lot of people either just knew that they were going to be a dentist in some way, shape, or form from when they were young, right? It was maybe something that their parents were or maybe instilled into them. So they went on that path of being a doctor or a dentist. And then we have other people such as myself who started off in a completely different industry and then came into healthcare. So what is it for you? How did you start your journey? What motivates you to go down the dentistry path of healthcare?
Yeah, well, first of all, thanks for inviting me. That really means a lot. And starting with my journey, like you mentioned, sometimes it's a catalyst from family. So for me, it was family. Before my mom retired, she was a dental assistant, and she advanced her career in such a way that was inspirational to me, and also introduced me to other dental professionals. You go to her workplace, or you see some friends of the family and things like that. So from an earlier age, I knew that I wanted to do something in health. I just didn't know it was going to be dentistry till probably college. You're introduced to it. You get a little bit of it here and there, but you really don't make a decision until you learn more about it when you get older and you get more mature. So it's easy for me to say that, oh yeah, I knew at the age of 10 I wanted to be a dentist, but that's not really true. I mean, you have an idea, but you experiment in with different scientific fields and study and whatever you want to study in college, and that's when you realize that this might be a good match. And honestly speaking, until you start and you get through your first couple years of your career, you don't really know you like it or not. But for me, I love it, so got lucky.
That's amazing. Yeah, you definitely got lucky, right? Not to know the outcome beforehand. And I think that's a lot with everything, especially with healthcare. It's so broad. There's so many journeys within healthcare that someone can actually travel down and go through, right? It's not one size fits all. You even said, right, you probably had an idea, but you didn't know what it kind of entitled once you actually start working and learning about this stuff. I guess what is for the average person, or maybe someone who is in this same journey trying to figure out which direction in healthcare to go to, what is something about dentistry that the average person might not know, or what is a misconception that you could maybe share that the average person might not know about becoming a dentist or dentistry in general?
I mean, there's a lot of misconceptions. There's some positive misconceptions. There's a lot of negative connotations, positive being that people think that dentistry is an easy job, or, at least you don't have to worry about being on call and that kind of stuff. That's not true. I mean, especially if you own your own business or your own dental practice, there might be a lot of benefits to dentistry, but it's not an easy job, and it's not something that's easy to get into. It's getting harder and harder every year to become a dentist, and it's getting harder and harder every year to remain a dentist. Landscape is changing. So the misconception from back in the day that dentists are people that just didn't want to go to medical school. Dentistry used to be an offshoot of medical school back in the day, and now they have dental schools which are really difficult to get into, and again, it's not an easy career. So if you're going to get into it, you just know that you have to be dedicated, and you are not going to be you're not going to be completely stress free of the medical part of it, the healthcare part of it, taking care of people, studying dentistry, hand skills. It is a physically demanding job. Don't just think that it's an easy out to becoming a doctor of some sort. And there are also some other negative connotations. People think that dentistry is, dentists are greedy and there's going to be pain and they don't care. It's not true. I mean, just like any other profession, there are good actors and bad actors. There are plenty of dentists who go into public health. They sacrifice their career and their, maybe not sacrifice, but they give back. They could have easily taken a different option, a higher paying option or an easier option, but there are plenty of dentists who work in the middle of nowhere to give back. There are plenty of dentists in armed forces giving back. This is Memorial Day today, so let's talk about that, right? So there are tons of positive and negative connotations. That do your research. If you're going to go into dentistry, talk to dentists, talk to different type of dentists, do your research.
100%. It's always good to get knowledge from the people who are actually doing the work. You just going down their own path. I always suggest that people find a mentor if they're able to. Right? Sometimes it's hard, right? But find a mentor in like the niche or the specific domain that you're working with. You said something earlier where you said if someone becomes a dentist, they're not going to be able to avoid like the health part of it or the medical part of it. We often talk about healthcare, how health isn't just one thing, it affects multiple things, right? So we know that maybe if someone has a toothache, it can also affect them mentally in some way, shape, or form, socially in some way, shape, or form, and vice versa, right? A lot of the people that I worked with, they dealt with a lot of social issues, so their social health was at risk a lot of the time. We might know that Mrs. Jones have a high A1C, have hypertension, taking a lot of these things. She should be seeing her primary care doctor as often as possible, but she isn't because now she's on the verge of an eviction or she doesn't have the right things to eat in home. So she's not going to her doctor. She's trying to pay her bills. And we know that there's so much things that impact health in some way, shape, or form, dentistry being one of them. What do you think about that? How do you think, other angles might affect someone's health, or have you directly worked with a patient where, maybe they came in for something specifically on their mouth, but you found out that it was impacting a lot more what was going on?
Yeah, man, we see it all the time. Half of our jobs, especially if you're a practice owner, is dealing with people's emotions and personalities and sometimes mental health issues or social issues, right? It doesn't have to be that they have something diagnosed, but they could just be going through anxiety about something, right? So that's a big part of it. And that's what makes being a healthcare professional a little more difficult in some cases, because you're not just doing the physical work, you're not just doing the academic work, but you're also dealing with people. And that's not in a bad way. You should be able to, comfort someone that's coming in with let's call it a toothache, or, they maybe have, social anxiety because they don't like their smile or bad breath or loose teeth, or they're wearing dentures and they keep falling out. There's many reasons why people can feel anxious about dentistry. The cost, we believe it or not, it's not us who set the fees. It's usually the insurance companies that set the fees, and they also then refuse to cover, provide the benefits to the patients sometimes. So financial can be an issue. People can feel ashamed that my last dentist or my last friend that I talked to about my teeth judged me, and I don't want to feel that way. That's all valid, but we see it all the time. And, for us, a lot of people think that dentistry is like, toothaches or making teeth pretty, but there's a lot that goes into it. We also look at the overall health. We can sometimes identify systemic issues in the mouth because the mouth is a gateway to the body, right? You go to the dentist every 6 months, as you should. We're going to see you a lot more than your primary care doc or a specialist doc can. So yeah, a lot goes into it, including sleep apnea. People feel crummy all the time. They don't feel like they got rest when they wake up. They feel tired. It could be sleep apnea, and we're the ones who might be noticing it, because when we look at your airway and we see your teeth being ground down and your tongue being in the way, then let's get you some kind of help, so you're not feeling tired and anxious and stressed all the time, because then you're actually getting some sleep. So there's, this can be a whole hour-long conversation just about that one question.
Right. That's amazing. I didn't even think about like how much how much mental it would affect you, because you're right. Like, so I grew up obviously I have a gap in my teeth. So I grew up for a long time almost insecure about my gap for a very long time. But as you were saying this, I'm like, wow, like that was at a young age. I don't think I was like mentally upset about it at the time. I just think I was just young and just getting picked on at that time. But as you
Right.
get older, it can affect your behavior, your mental, and how you smile and do you don't smile. There was a point in time where, like, from like 8 to 10, I probably don't have no smiling pictures at all, because that was around the time where I knew I might have been self conscious about my gap. Now I got white teeth, I have dimples to die for. I don't care about that. But the average person might actually, have, be battling with something mentally because of that. I'm glad you brought that up, because I hadn't even thought of that. But, you making it, bringing it to the forefront, that's like an obvious thing that could happen to anyone. They could be self conscious about their smile, and living through that could impact them. One thing we talk about a lot with our guests is technology and how it's been reshaping our industry in some way, shape, or form. It's interesting because we talk to a lot of people on either sides of the healthcare field. We often talk to dentists who are at the forefront of technology or are more open to technology than versus, primary care physicians. For some reason, I don't know. For some reason, the dentist group or the guests that we've had, you guys are like 3D printing, AI, you guys are already on top of these things. What are some technology that you are using, actively on a day to day, or something that might have impacted how you actually work?
Yeah, so I think because we're in the dental profession, and especially if you own your own practice, you can make those decisions a lot more freely than compared to a primary care doc who's working for a hospital, perhaps. So first and foremost, I use a CBCT, 3D X-ray machine, to be able to check for jaw issues, to be able to check for pathology or pathoses that may not be visible on a 2D X-ray, right? That helps a lot, just being able to diagnose correctly. So I'm just taking it back to like technology that's not at the forefront. This is what most dental offices don't have, a CBCT. I'm lucky that I have one, or I worked hard to get one, so I do use that. I helped develop an AI chatbot, and then that evolved into an AI assistant, phone tree assistant, or phone assistant, and then now that's evolving into a more capable dashboard of helping perform many dental office admin tasks. So, something like filling the schedule, or answering the patient's questions about their payment situation, identifying gaps in the business system, the systems SOPs you have. So that's going on. Marketing, tracking marketing to make sure that the phone calls are being answered and grading them and all that kind of stuff. But that was at the forefront maybe like a year or two ago, but now that's becoming more and more accepted. There are still many products out there that are still not great. It's a very fast evolving field, so you have to try it out. For example, patients don't like talking to AI. They want to talk to Susie that they've been talking to for the last 5 years. So
And Dr. Karthik,
Right. They have.
do you think that dentists are more tech savvy than other healthcare professionals like psychologists, psychiatrists, or psychotherapists? Do you think they are more towards AI, they are more towards the modern technology and stuff like that?
I don't know, because I don't know much about how like a psychotherapist would operate, on a day-to-day basis. But I will tell you this, that we do have to be at the forefront of technology in some cases, because that's literally our job. 3D printing crowns, for example, or 3D smile makeover. Sort of like a virtual mock-up. CBCT, using it properly, identifying it. Those are all things that are become like it's part of our skill set. Now, because I don't know much about what other medical professionals do. I don't know if we're more tech savvy or less tech savvy. I do know this, that even within dentistry, there are still offices still using paper charts instead of using computers, and computers have been around since for the 90s pretty much. So I believe that as a profession, I don't want to compare to different professions in healthcare, but I do believe that we are more technologically advanced, just because we have to be. But that's not a blanket statement, because I know plenty of offices that don't do any of this advanced stuff. They just do like basic stuff, and that's fine. So I don't want to give you a definitive answer, because I don't know the answer. I think I'm going to say depends on the office, depends on the doc, depends on the technology available, and depending on what they're using it for. But as a general rule, if you can keep up with dentistry, you got to keep up with technology, because things are changing quickly, even just from a physical standpoint, forget about the AI stuff, forget about all that. If you're making crowns, there are better and better materials coming out, better and better ways of doing it. Simple as that.
I think. How have you been able to? Because it seems like like you said earlier, it's a lot. You're able to implement new technology or try new things such as AI because you're on a private level versus a primary care who might be in this large health system who might know an AI tool but can't put it into play because they have these restraints. But for you, how did you actually start to, develop this chatbot to then agent who's answering questions to now a dashboard? How did you go down that kind of pipeline? Is it you more so doing your own knowledge of AI and then implement it to your day to day? How does that work? Because reason why I ask is because you're right. A lot of the people that we actually have on the show, it's they're using AI actively or they're not using AI like at all. It's not even a thing that they're thinking about to do anything, right? It's just something that it might have came down the pipeline at their job. They're not using AI outside of work. They have no idea about the technology, and that's what we're finding. So how are you becoming familiar with the technology? Are you just doing your own homework, or how does that work?
So I'm not a coder, and when we first got started, AI was not a thing. Like ChatGPT was not a thing until a couple of years ago, whatever. But coding was still a thing, and I'm not a coder at all. I use an iPhone. I can't even do Android. I'm that behind with the technology. But you meet people, you meet people, you troubleshoot, you network. And so one of the things that we came up with was our website back then didn't have a chatbot, so we implemented that. But it wasn't just like, let me buy your chatbot and put it on my website. It was more like, let's audit this. Let's work together to design it properly from business owner's perspective, from a clinician's perspective. And then that evolved into a phone assistant, because we were noticing that sometimes we're missing phone calls, and then the marketing is not being optimized. So then I worked on that. And again, I'm not a coder, so all I did was partner up with people that knew what they were doing, and we thought, okay, well, let's use my office, as a HIPAA compliant and everything, BA, all that.
Right.
But let's use my office as a way to test what you're doing.
Right.
At the same time, have redundancy, so if what you're doing is not working, at least my staff can handle it, right? So that evolved into what we liked, what we didn't like. I mean, the phone assistant was amazing, right? Like, you can call it up and say, hey, my name is Anthony Virgo, this is my date of birth, what's my balance due, or when's my next appointment? It'll know it.
Right.
But what we realized was that patients didn't like that. So instead of implementing it into my practice, we then evolved it into the next thing, which we're like, hey, if this is not working business to business, as dental office, then perhaps you can use this with marketing companies, or we can use this with other dental adjacent products, right? So like a marketing company that caters to dentists, or AI imaging company that caters to dentists, or whatever it might be. Then let's use that dashboard, then maybe help them, but you're still helping the dentist indirectly, but now you're taking the burden off the office. Now you're testing it, when the patients are not in need of immediate assistance. So that's how I got my start, and that's how it evolved. But again, I don't know any coding, man. It's like I'm the user interface guy. I'm the person that gives ideas that this is not going to work because dentistry is like this, or this is going to work great because dentistry is like that. So that's how I work.
Amazing. I love that you said that and described that for us, because that's usually how we approach AI the same way, or just technology the same way, in terms of like, being that we come from the healthcare background system, we're sitting with providers, we're sitting with primary care physicians, psychiatrists, behavioral health specialists, dentists, to then figure out the nuances, right? To understand it a lot more. You also mentioned making sure things are HIPAA compliant and BAAs, which is key, because a lot of what we find in healthcare is they will bring in someone to do AI that doesn't have the knowledge of HIPAA, haven't been client facing, don't know what it's like to sit down with a client. To implement a tool like that without that background, it's almost like expecting anyone with a hammer to build a house. I know how to use a hammer, but I don't know how to build a house. And oftentimes when we have conversations with people in healthcare, or even if it's our clients ourselves or someone who doesn't even work with us, we often say, if you're gonna use this new technology or use AI, make sure you find someone who's an expert in that niche or domain. Meaning, we're not doing AI for, like, Kazar and myself, we're not doing AI for like hotels and things like that. Of course, I could build an AI agent that can answer a phone for a hotel, but I don't know the nuances of checking in and checking out and things like that. So I'm not an expert. But if you're thinking about like healthcare, Of course, I'm gonna have HIPAA at the top of my mind when building an agent. Of course, we're gonna talk about, BAAs and how we integrate the EHRs and stuff like that, because I have that background, if that makes sense. I think the good thing about what you said that you are doing, or the flexibility of being into AI, was you were able to pull in these coders and give them direction in a sense. And we feel that's what makes one AI. You can never replace a human because of that piece of it, and then also keeping a great adaptation to AI, to where it's not like, hey, AI is replacing people, is we're implementing it and then organizing it in a way to benefit what we do and allowing us to be more present, if that makes sense. 1000%. And I think with the approach that you outline, I think a lot of people are missing that part of it, right? Doing their own homework or networking with people to understand it a lot more. So then they can say, okay, I have a fresh new eyes on this project. Maybe we can use it. Maybe we can use my office to test it out, but train my staff on how to actually, if something, to put out a fire, or to stop it completely, or to use it on a day to day. That's what we kind of preach, or we go out there and advocate and give resources about. People in healthcare should do their diligence in learning about the technology on their data. So I love the way you outlined
Yeah,
that.
I think you should also remember that you got to train the AI as well. You have to keep changing it. You have to let it evolve and train it. And I think that a lot of people think that AI is like actually completely thinking on its own. It's really not. Most of the time it amazes you. Like you can do it, but you should use it as a tool, right? Think of it as like a very advanced calculator.
Right.
You still got to be responsible for answering the questions correctly on the exam. Just because you have a calculator doesn't mean you're going to get an A. So,
Right.
so that's the part of it, that you have to be able to apply logic and apply common sense sometimes. Don't just use AI for like everything, because it's a tool. It has to fit. Like you said, if you have a hammer, you can't build a house. You just know how to use a hammer.
Right.
So it has to be trained as well, along just like a human staff member. It just learns faster. That's all it is.
And
Right.
Dr. Karthik,
1000%.
what is your message to the dentists and the healthcare professionals who think that AI is here to replace them, or they are or the healthcare professionals who are very scared of AI? Like, we have a lot of healthcare professionals on our show, on our podcast, who are just using ChatGPT, just using Claude, and who are unaware of the other amazing use cases of the AI. And in fact, they are scared of it. So, what is your message to those healthcare professionals and those dentists?
Yeah, I don't think AI is going to replace medical professionals. You're still going to need actual, doctors and nurses and assistants and all hygienists and everyone else to help. A lot of healthcare is, like I said before, emotional intelligence, meeting the patient at their, psychogenic factor sometimes, or psychological factor sometimes. A lot of it is hand skills. Even now, you have robots that could place an implant for you, but you're still the doctor. You still have to be able to properly treatment plan it, and you're still responsible. So I don't think that healthcare professionals need to be scared of AI replacing them. It's just a tool, just like anything else. And yeah, it is a little scary to like imagine that if you have a manual job. So if you're not like a surgeon, if you're not a dentist, and you're thinking, man, maybe the AI can replace my medical diagnosing skills, it can't. And if it makes a mistake, someone still has to be there to catch it. Think about cars. There are so many cars now that are autonomous, right? You still got to have a driver.
Right.
You're still responsible if something happens, and you see people ignoring that. But I don't think AI will replace healthcare professionals as a whole. Yes, some here and there. You might not need that random tech that just because the machine does it now. But as a overall, I don't think you got to be cautious, but I don't think you have to be like scared of.
I'm gonna be honest. That's the thing. Like, I think there's a lot of fear in the news and a lot of unknown, right, uncertainty, to where people are just so turned off about it that they're not using it to their advantage. So that's ultimately what we think. This has been an amazing conversation and so much value. Where's the best way where people can actually connect with you? What are some of the channels where, people want to either ask you questions? They might have heard something on the podcast that you mentioned. Where can they actually connect with you and reach out to you if they have any questions and anything else that you have going on in terms of any events or anything going on with your practice.
Yeah, I'm happy to connect with really anyone. I have always been like an open source. They can look me up on LinkedIn, which is usually the best way to do it now. I'm not the greatest at checking LinkedIn, but it does notify me. So that's one way to do it. Or they can email me directly at kaantani@gmail.com. That's pretty straightforward. I'm online. They can look me up.
Got it, got it. And one question we asked before we head out, what's one powerful message you would love to leave with us and our listeners? It could be anything from your, personal private journey or anything we talked about today, but what's a powerful message you want?
Yeah, I would say that on a personal and professional level, set up some boundaries. Don't be that guy that just like has no boundaries. You got to be able to cut off work. You got to be able to cut off responsibilities here and there and actually enjoy your existence. So have some boundaries and trust yourself with it. That's it. You're gonna go through ups and downs, and AI might take your job. No, I'm just kidding, but things will happen, but set up the boundaries that make you a whole person. It'll make you feel complete, and then trust yourself.
Thank you so much for being on this episode. This has been so much value. We actually will probably invite you for a part two, right? Because we know this technology might change. We want to see what you got building in your practices and what you're working on as well. But we just want to thank you for your time and thank you for being on this podcast.
Yeah, it's my pleasure. Thank you.